good morning. My name is Beth Kayanan, and today I'm going to be showing you how to set up the CO2 laser and its application for GYN. This is the Apicos Duo. So this one is you just plug it in, turn it on. There's a button at the top. Password will be here. It's 1234. So when you're testing the laser, we're going to test it with the freehand. Because we don't have a testing fiber. This is for the fiber. So we're just going to test it with the freehand, okay? So to test it, we're going to put Surgitouch treatment. And then you're going to select which service you're doing, either GYN or ENT. We're going to select gynecology for this one. And then there's a scanner, F125 and scanner F200. There are two. So if you're going to test the AccuPulse, there's an incisional handpiece. This is what it says, AccuPulse CO2 laser. This is what's in here. These are the handpieces. Take it out. There's a pull lever over here. Pull it out. Be very gentle. Take this as gently as you can. Turn it around, and then if you put it 90 degrees, like all the way to 12 o'clock, you're going to hear a click. So this means it's not going to fall down. So it's locked in place. And to unlock it, there's a lever also in the back that you have to press down. And then, oops, sorry. And then this one is free. It's gonna fall if you let it go. So we're gonna lock it for now. And then we're gonna connect it to our handpiece right here. You can select either one, it doesn't matter. They're both F125, that's all we have. And this one is just to stabilize your hand. It just screws in at the top. And this one just goes right in here. Okay? So now this one is ready to test. And to test it, I always have a tongue blade, a towel with a sterile water. We're going to wet it so that our area is wet and that it doesn't catch on fire.
What else do they need to remember when testing?
Well, when testing, of course, you should have the coverings on the windows, on the doors, sign outside. This is the sign for the CO2. And also, you should have goggles on the doors. And of course, as an operator, you should have your own goggles too. Okay? So now we're ready to test the laser.
Go.
Oh, okay. Ready? So to test it, you're gonna press Surgitouch, gynecology, and then F125, and then you're just gonna push treatment. We always test this at no scan, and it's gonna be CW, which it is, and we're gonna hit continuous. And then the watts, we just increase it to 3 watts. There is a foot pedal in the back. Up again, right here. There's the foot pedal. Always remember, only give one foot pedal to the surgeon. If they have a bipolar, microscope foot pedal, take it off when they're doing the laser. Okay? So now I put the X on the tongue blade, because what we're seeing is the aiming beam. So where the aiming beam is pointing, that's where it should be hitting. Remember, laser is invisible. Okay? So we're gonna test it. Everybody have goggles. I have my water. I have my fire extinguisher. You put it on ready. Wait for it to say that it's ready here before you hit the foot pedal. So it says power conversion succeed. So now it's ready. Now we go back here. You aim it to where you want to hit it. You press the pedal. Once you see smoke and it's hitting exactly in the middle of the crosshair, you have tested the laser successfully and you put it on standby.
Okay.
So now you're done testing it, so you're just gonna put away this if they're using something else, like for example, the fiber or the micro manipulator. So just stash this one back in its case, and you can put this back in the drawer. So now if you're gonna use the fiber for your case, just like in case of laparoscopic GYN cases, you're gonna go to fiber treatment, and there it is. You will see that it will illuminate here, and I always turn this thing around so it's facing the field, and then you just screw the fiber in here and it's ready to go. So if you're doing micro manipulator like in case of airway for ENT, this suitcase comes from the ENT clinic. It lives in Dr. Song's office for right now. So he will usually bring this, or you may have to pick it up from here. So what's in here is the micro manipulator itself, which we're gonna attach to the microscope, and the cord that will connect to the laser, and also the filter that goes on the microscope to protect the surgeon's eyes. So all of this should be in here. The first thing that I'm going to do is to show you how to put the filter on for the surgeon, okay? So I always have something underneath the microscope, so if in case I drop it, it just drops like 12 inches or less. This one slides in here, tighten this one, and then this just goes back in its place. Make sure that it's seated flush to the filter. Make sure everything is tight. Give it a little wiggle. Make sure that it sits right there. Now we're ready to attach the micro manipulator to the microscope. So if it's easier for you, you can angle it this way. And you see this? You just match it. You start at the top. Make sure it's flush, and then there's a little screw in here to the side. Make sure it's tightened. Give it a little wiggle. It stays in place, okay? Mm-hmm. So now your micro manipulator is connected. Okay, so if you're doing airway, so you're gonna go back to home. You're gonna hit SurgiTouch. ENT, usually they do larynx and then AccuBlade 400. The only difference between 350 and 400 is the distance of the microscope to the area that you're going to be lasering, and then you can hit treatment. So now we're ready to connect the laser to the microscope to the micro manipulator. So same thing, you pull this out gently and carefully, making sure that you don't force anything. Put it on the 12 o'clock position. You hear the click, so now it's safe to let go of it. So this one will connect directly here. It connects directly to the micro manipulator. So now it's connected. Your laser is now connected. So now we need that cable to connect from the micromanipulator to the laser. It's kind of hard sometimes to sorry. Okay, so now we're ready to test the laser with the micromanipulator. So this is the setting that I tested on. Scan CW 10 watts, and Dr. Song or whoever your surgeon can change to his own setting, but you can test it on this one. So it's similar to testing it with the hands-free. You should have a wet towel, wet tongue blade with the cross, the X's, so that we're seeing the aiming beam and the laser is hitting where the aiming beam is. This is the micromanipulator joystick, so you can move it. You don't even have to move your microscope. You can just move it through where you need it to be. Again, one foot pedal at a time, no other foot pedal when they're operating the laser. So now we're ready to test it, so we're just going to put it on ready. And once you see smoke, ready to go. Now that you have tested the laser, and if you're using the micromanipulator, just leave it as it is. It's ready to go. But if you're using fiber, we're going to have to take this apart. And to take this apart, we just go backwards. So first, I'm going to disconnect this by pulling this thing here, and then it will easily come off. If you have to force it, or if it's not coming out, then you're not doing it right. There's a mechanism here that you have to pull this down. Okay? And then after that, you're just going to disconnect your microscope. And you're going to start, you can just leave this one here because it's not going to go anywhere as long as you lock it. And we're going to loosen it here, take it off, and put it in the case.
What about this? They can remove.
Oh,
they can.
Yeah, we're gonna remove this one too. Same way. I'll set this up one somewhere safe. Set this off.
Lefty loose.
Left it loose.
And put it away.
And then we put
And go.
Okay, so now that you have tested your laser with the freehand, with the incisional handpiece, and if you're using a fiber, or in case GYN laparoscopy case, you will need this. This will come from the field, sterile of course.
Sterile.
Your tech will pass this off to you, and all you have to do is remove this cap, go over here, give it a little push, and it will go in easily. Screw it in like finger touch. Okay, now it's tight, and we've set up from, if you go to home, just fiber treatment, and it's usually CW, continuous or repeat, go up to 3, that's usually their setting, and it's ready to go. Just give them the foot pedal and hit ready, and you're ready for surgery. Now we're going to test this Ultra Pulse Duo with the micromanipulator for ENT application. So first thing, plug in your laser. There's a switch here that you will turn on. And then there's a key that you get at the front desk. You turn it on like you're starting a car. I already started the laser, so in the front here you will see surgical. And since we're setting it up with a micromanipulator, we're going to get ENT. And usually they do larynx. Same thing, digital, I always pick 400. And then you're going to go to treatment. And it's ready to go. Now we're going to connect it to the machine. To the micromanipulator. So to do that, you have to unlock from here. And then there's a lever here that you're going to pull out. Please be very careful not to drop this, okay? So now your arms, you see how this one is like free falling? There is a balance here that you can use to either pull back so that this thing is floating in the air. So I think now it's kind of floating.
Yep.
And then you're going to lock it in place. So now this one is free floating, so it's not going to fall. To connect this, a slight difference between the acupulse, you're going to need this. This goes with the micromanipulator too. So you're going to connect this, it doesn't matter which way. It does matter. So you're going to connect this. Be careful that the joints are not hitting each other, okay? So I would just go here.
Screws in. Alright. And go.
So to put it back in the stove place here, you just put this here. You go here to the side, try to pull it from the top where it's heavier. Lock it in place here. And push this to lock it in place.
Right. Okay.
Now I'm going to show you how to switch the ultra cool fluid to fiber. So we're going to hit that and then hit fiber here. It's going to switch. You're going to see that this is going to get illuminated over here on the side. So this will come from the field. All you have to do is open this. It goes right in here. There, give it a little push and lock it finger tight, and it's ready for surgery.
Alright, good morning. So if you have a laser case, obviously you're going to have to get your laser card. Your laser card should include your door signs, which you would place on the doors outside of the room. And then you also have your covers for your windows. Anything that's like open where you can see through the room, you have to place a cover. And then you should also have your goggles in here. So the other laser card, which is for Iridex, it has its own goggles. So make sure that you're checking your goggles, inspecting for scratches, and if it's still good to use, then we can keep it. If not, then we'll have to toss it away and maybe order some more. So like I said, you have your goggles here. You have some more door signs in here. You also have your incisional, what's this? The handpiece set. So you have multiple handpieces right here. You have your thumb blades for testing, and we also left some blue towels and stereo water in here. So going back to your laser card book, it should tell you that this is specifically for Lumenis, so you can use it for both AccuPulse Duo and UltraPulse Duo. I created a new peri-operative laser safety checklist, and I made sure that it's already labeled as AccuPulse Duo or UltraPulse or VersaPulse. The VersaPulse, we don't really need a laser operator for that, so you don't have to worry about doing all the testing because it's a class 2 type of laser. But you still have this form if you need to do your documentation. And just going back to this form or this folder, you have your resources here. This is the AOR and laser safety reference guide. So you can read on this if you have time, and if you just want to go, review some of the laser policies. That way, when you get a laser room, you'll know what to do. We also have the different types of laser in our operating room. Like I said, we have the Lumenis, AccuPulse, and UltraPulse, and we also have the Iridex, but currently it's in med maintenance. And then right here, it tells you who are the laser credentialed surgeons. If we have new surgeons, just make sure to verify with credentials if they are allowed to use a particular laser equipment. And then this will be updated, but this is our list of laser trained personnel right now. The goal of this PI project is to have more personnel competent in laser equipment so that this list will have more names on it, and then we will have a separate laser operator from our circulator. And some of the following sheets are just multiple references that you can use.